Great. Well, thank you very much to Anne and Judith for again facilitating this lightning talk on behalf of Newcastle Health Innovation Partners, and welcome to you all for joining at this lunch hour. We're not going to keep you for an hour, we're going to keep you for half an hour, and I'm really grateful to you all for your time again. The sheer number of you that have signed up for this, I think, is testimony to the fact that these talks are starting to gain quite a bit of traction, I think, generating quite a lot of interest, and also perhaps the actual subject of this current talk, which speaks to a very, very wide audience indeed. And the clues in the title, as you can see there. So improving health, reducing inequalities. We need to start much earlier. And who better to talk about that than NEWCASTLE, who's one of our leading lights in the Faculty of Medical Sciences, who is a reader here in population health sciences. She's a theme lead. She does a whole raft of things, including helping with the education and training portfolio as well for the Health Innovation Partners. She's passionate about non-medical allied health professional careers. Nina's joined by Sunil Bhopal, who is a clinical lecturer in the trust. He is on the rise, just got himself onto a national leadership experience program, and many congratulations to Sunil for that. He also, in his day job, works in pediatrics. So really, we've got two excellent experts to speak about why we need to start much earlier. So over to you, Nina and Sunil.
Thank you, David. And Sunil's going to kick us off.
Thanks a lot, and thanks a lot for the introduction. So good afternoon to everyone, and thank you to the organisers for the invitation to speak, and you, of course, the audience, for coming to listen. So today we're going to make the case that if we, as I imagine that all of us probably on this call want, if we want to improve health and reduce health inequalities across our region, we need to start much earlier in an individual's life. What are we talking about? We're talking about that period through pregnancy and the crucial preschool, early years of childhood. It's not just cute babies, although that's part of it. It's many decades of laboratory, clinical, and epidemiological evidence pointing to this stage being really, truly foundational to the rest of lifelong health and well-being. Our practice has not, in our views, caught up with this evidence base yet in several ways, but there are serious opportunities right here in the Northeast, not least given our history and where we've come from, but also our current expertise, for us to seriously lead on this across health, but not just health, across education, social care, and poverty alleviation across the whole children's sector. So I'm Sunil Bhopal, clinical lecturer in population health pediatrics, splitting my time between the university and the trust. Nina.
And apologies for being slow to move the slide. I was having a technical blip, but there we are. Thank you, Sunil. And I'm Nina Heckman, reader in Allied Child Health. And obviously, Sunil and I are here today as ourselves, but what we wanted to highlight that we are really part of a much, much bigger ecosystem that has been built over several decades here in the Northeast. We're all working together across sectors to improve early life and life course health in the Northeast and North Cumbria. And what's really exciting and important about this is that this has all been collectively built. So Sunil and I are here as ourselves, but also as very proud members of this wider community and amazing infrastructure. So most of you probably know what the NHIP is, but for the benefit of those who might be new, this is Newcastle Health Innovation Partners. And NHIP is a prestigious collaborative cross-sector award, and the Newcastle Innovation Partners especially aims to become the most integrated and innovative academic health sciences partnership in the world. And what it states in its vision is that this will look like as improved health and reduced inequalities, as excellent science, innovation, and discovery embedded in the real world, and economic growth and future-facing workforce. So this is very much this vision and ambition of NHIP is setting up the scene for what Sunil and I want to propose in terms of early life and the importance of children's health.
And it's not, and we'll go on to tell you about health and healthcare and medicine and all the rest of it, but it's not just those that love children or think that health is important who care about the early years. So here's Nobel Prize winning economist James Heckman's curve, highlighting that high quality investment in supporting families, childcare, preschool learning, access to health services, especially for those who are most economically deprived, offers a return on investment that cannot be beaten as children grow up through to school age and on into young adulthood. You get a better return on investment if you intervene early through the prenatal period and early childhood than you do if you wait until children start school. So on to the next slide. If we accept the rationale for investment in early life, well, what should we focus on? What are we actually talking about? This is the Nurturing Care Framework from the World Health Organization, UNICEF and the World Bank, providing a universal, internationally endorsed framework for thinking about this. And it combines elements of high quality nurture for children across health, nutrition, safety and security, opportunities for early learning, and really key here, responsive caregiving from at least one happy, healthy, securely attached caregiver. So when we talk about the early years, we're not just talking about children, we're talking about the adults that care for them, and a really holistic way of thinking about families. And here's a lovely quote from the Director General of the World Health Organization, Dr. Tedros, that period through pregnancy to age 3, when the brain is growing fastest, that's when all our children need a safe, secure and loving environment with the right nutrition and stimulation from their parents, caregivers, and supported by strong public services. So let's give you some concrete examples of this. So for these different aspects of nurturing care, where we are at the moment in the Northeast and North Cumbria, let's take vaccination to begin with, probably the massive success story over the last 100 years. Let's celebrate those successes. Still improving, still being added to. See the pneumococcal vaccine introduced 16 years ago and the changes brought about to pediatric practice seen in hospitals because of that. But we also see pandemic-induced decreased prevalence of coverage of vaccination. And we're considerably below the aim of 95% of vaccination for MMR, as we'd be aiming for. And this is worse for those with the most deprivation. So we see inequalities here. Let's take another one, poverty and deprivation. We've got a legacy of work of Sir James Spence, the first professor of child health in England, who post-World War II sort of exposed the crucial importance of children in society. And when I read back at that history of work here in the Northeast, it's really very inspiring for my own career, pointing out the adverse influences of poverty on children's health and well-being. And of course, the 1,000 Families study, which was launched within our city, where lots of those children remain under follow-up. And yet 37% of our children in the Northeast live in poverty, second only to London, with great impact on health, well-being and social care throughout our city. And where are we right now with children being ready to learn or school ready when they turn up in school age 4? Well, sadly, at reception class, 30% of children in this city, in Newcastle, are not achieving a good level of development in reception class. More than a quarter are not able to communicate and use language skills. Children in our classrooms, these children in our classrooms are not ready to do simple things, listen to stories, pay attention. I hate to be the bringer of bad news, pay attention, use the toilet, dress themselves, having started to read, write, do simple sums. So we're talking about simple stuff that we all want for our own children and that all children have a right to expect. And this has knock-on effects for the rest of society, as we're discussing. Nina.
And thinking about the sort of long-term life course health behaviors that start early and cumulatively build either towards a good, long, healthy life course or a developing long-term condition. So let's think about obesity. In the Northeast, quarter of children at reception are overweight or obese. Quarter have tooth decay by age 5. On average, on 3 or more teeth. Less than half of 5 to 16-year-olds in the Northeast get enough physical activity just for enough for well-being and health and development. And we don't even have the figures and data for what happens in under 5s. A patchwork of data across different parts of the system suggested that mental health in young children was already a growing problem before pandemic, and now with the impact of pandemic, that's going through the roof, and with the heavy interaction effects with poverty that Sunil alluded to, this is a particularly concerning problem.
So why does it matter, and why should we care, and why do we care? We care about children, we care about the children who are going to turn into adults, and we care about our societies. And if we think back to the Heckman curve, we care about economic and productive societies that can get on and do things. So if we want to improve health and reduce health inequalities, we are going to argue that starting early is the way to do it. So as we sort of come full circle in our little short talk, what's the opportunity here for our city, our region, for the Newcastle Health Innovation Partners? Well, I think it's fair to say that we are global and national leaders here in the city and in the region in many areas of healthcare and medicine of childhood. So genetics, cancer, immunology, neonatology, you name it. I've probably left some very important people out there, but we know what we're doing. People in need come for bone marrow transplant from around the world when things are going really very wrong in childhood. So I think what we're talking about is adding to this hospital and technology-based activity, complementing it, not either or, working across sectors, outside of the hospital, in the community, across professions, outside silos and outside comfort zones. And of course, we have many strengths in these areas, and building on them offers a real opportunity for improved population health.
So some examples of that is, Sunil's very modest, but he has really been one of the internationally leading people publishing early work, looking at data in very innovative ways on the impact of COVID on children. And that's had tangible changes to how the policy decisions have been made about restrictions and rules that affect children during the COVID pandemic. Our allied health, for example, speech and language therapy colleagues lead amazing work building on the decades of legacy in the community epidemiology studies, adding new and innovative data collection methods that don't just look at how does the children development happen in the lab or in the clinic, but actually looking at the development and advancing the methods and the technology to capture data in the community settings in very young children. Our colleagues in childhood onset disability are leading various programs of work, looking at the use of large-scale data, what can be learned from the changes that were put in place during the pandemic. And then together with colleagues like Ian Robson in Northumbria, there's really exciting international leading work in complex systems and learning health systems, engaging with community stakeholders across sectors and jointly redeveloping ideas and systems. Sunil, this is over to you. You're on mute.
Oh, we were doing so well. And what we describe is really part of what the NHS is talking about in the long-term plan when they're talking about inequalities and prevention, and really shifting ways in which the NHS is functioning. So we're hopeful, and we think that this is going to be happening around us anyway, whatever we do specifically as a group and as a region. But the NHS is continuing to wants to move from a reactive care model to a population health management model, working with local government and with voluntary sector partners on prevention and health inequalities. And then, of course, there's a lot of other things going on in this space, policy space in early childhood. So from the recent Andrea Leadsom review, you can see a picture of Andrea Leadsom down there in the corner, a serious sort of cross-party consensus that we have to do better in the early years. And you can see from her little quote there, if you can read it, 2 is too late, which is quite remarkable, really, to hear very mainstream politicians talking in that way. we need to get in there early. The Royal College of Paediatrics and Child Health, the Parent Infant Foundation on infant mental health and prevention of life course impact of that, to the College of Medicine down there at the bottom. And of course, here's the Duchess of Cambridge, who's just launched a Centre for Early Childhood, and the connection, and this is their recent report, Big Change Starts Small, with a lovely quote there from the Duchess. And the connection between young children and the rest of society couldn't be clearer from this quote and from the rest of the work going on in this space. So
I think what Sunil and I are saying, the policy and the big tide at the international level is heading this direction. In the Northeast and North Cumbria, we've got decades of leadership and expertise in this, including the various component areas. And if we are serious about wanting to become the leaders in improving health, reducing health inequalities, and supporting economic growth, then I think we do need to prioritize early start through pregnancy and the first years of life. And to make this concrete, Sunil and I wanted to put forward 3 suggestions for debate. NHIP very much describes in its vision the idea and commitment to life course health. If we're taking this seriously, then let's have a collaborative cluster for early life health and well-being and make that visible on our website and in our priorities, maybe building in some key metrics and milestones in there. Let's embed our early life capacity building into the much bigger and exciting capacity building plans that NHIP is leading on regionally, and you'll all hear more about that in the coming months. And then the really challenging one, just to put there in a third, a lot of the examples that we've talked about today are built on data and routine data and some key facts data collection that's been done and led in the region in the last 18 months. To take that to next level, we propose let's build a dashboard for real-time early life routine data that can inform cross-sector innovation, research, and practice change.
So just to end, here's a lovely picture from the World Health Organization, and this is what we're talking about, really. We're talking about lovely little babies supported by their adults around them. And we say that if we change the beginning of the story, we can change the whole story. It's the beginning of life. Thank you very much.
Thank you very much.
Thank you, Nina and Sunil. Fantastic talk there. And I'm just covering the Q&A, if that's okay. So I think the messages seem to be practice catching up with evidence, intervene early, invest early. Just encourage you to use the chat buttons and maybe focus around those 3 areas that Nina highlighted at the end, and we'll facilitate some sort of Q&A. We've smashed all records with over 200 people on this call, so well done. And we'll maybe if I just start, if that's okay, to both of you. If you can only choose one intervention, just one intervention, it's a bit cruel, this one. What might that be to make a difference over the next 3 to 5 years, fairly short term? What would work? What would work? Any thoughts on that?
Lovely question, difficult question. Oh, Nina, I can see you speaking, but I think you're on mute. But yeah, lovely question, difficult question. I think there are many sort of experts in this field who will be able to sort of thrash it out together. I think that there's a lot been said about the importance of health visiting and the importance of health visitors, and we've seen problems in that area, real problems in the early years. There's been a lot said about children's centres of various types, and we've got various different models of children's centres coming back after changes to the way that Sure Start has been working. So I think I'm not going to be able to answer the question, but I think it's going to be along those lines to get us going, and others may want to chip in who are on the call.
I completely agree, and I think the core focus is the family support and supporting the whole family and not just targeting the child in isolation.
Okay, that's great. Quite a lot coming through, actually. Nicola from the local maternity neonatal system wants to connect and join up. Jill has asked the question, how can schools be involved in collaboration cluster for early life, especially in special schools with very poorly pupils from the age of 2? Any thoughts on that?
Sunil, do you want to jump in first?
Yeah, I mean, I think it's so important, isn't it, for schools, particularly special schools, particularly in those pre-formal schooling period, to get involved in this sort of thing. And I think, you know, we need to think about what we're going to do within, say, people who are on this call will know about Children and Families Newcastle and the way of working in this joined up way across the city, and how that's going to come together with other elements of a understandably disparate system. And it's a disparate system because we're talking about children and childhood, and it doesn't belong to one professional group. It doesn't belong to one sector. It cuts right across, and that's some of the difficulties we're having. And it's really going to require very serious leadership from unusual places to be able to bring people together across those sectors. So yes, I agree that the schools and special schools must be involved. How exactly it's going to be formed and come together, I'm not sure that I'm best placed to answer. I don't know, Nina, if you want to add to that, but I think the opportunity is there.
Yeah, and it makes me reflect that actually we had some of those partnerships developing really nicely, and then of course the pandemic has kind of created havoc throughout the system. So actually that's a really good reminder that we should probably pick up those conversations again. And if anybody from the school systems wants to drop me an email so that we can start to relink again, please just do.
And I think on that, Nina, there's a lot of points in the chat around linkages with other groups. Some reference there around the Newcastle Hospitals Inequalities Group, which certainly I'm aware of. Other organisations, Jill Bow mentions about Children North East. So I think it'd be nice to really see these connections. Ian Robson has raised the question, we have a new organisation and a wide range of partners in the region. Do you now think we have vehicles? Do we have vehicles we need to deliver worked examples of practice-based research you allude to? Any reflections on that?
I think some of that goes back to that first suggestion on our 3-point list, and that might be back to you, Peter, to take forward. If we could have a cluster for early life that sort of comes under the Newcastle Health Innovation Partnerships, the NHIP is already a cross-sector vehicle. It won't deliver the practical projects, but it could very much become the place where some of the linkage and the coordination happens. And what we've seen on smaller scale is where that starts to happen, we get a lot more impact for our resources. So yes, I completely agree with Ian that I think we're very much in the place where we can make the ideas to become the reality and the real change. And I think the NHIP cluster could really provide a good connecting point for that. Sunil?
Well, and just to add, you know, Professor Judith Rankin's on the call, who has made a comment about joining up the amazing initiatives across the city and region. And I think that is the difficult bit. And I think that's what I really feel there's an opportunity here for us to do within the city and region. And if it's the NHIP, fantastic, there's the opportunity, because there's so many people working in the council, in the health service, in the universities, in the NIHR, applied research collaboration, you know, and so on and so forth, Child Health and Wellbeing Network. You know, we've got a vice president from the Royal College of Pediatrics and Child Health on the call, Mike McKean. You know, we've got so many people doing great work. How do we bring it together, as Judith asks? I think there it is.
And of course, Judith is key part of the solution as the lead for the ARC Children Families theme. So absolutely.
I think Judith has also done some really good work recently on academic development and inequalities. And I know she's coming to the NHIP board in March, so that's good. I can't keep up with the number of the amount of interest here and the linkages with other groups. There is a specific question from Amanda Bailey. 46% of children in the Northeast in a family with the youngest child under 5 are in poverty. And it goes on, you've highlighted the importance of this issue. How do we work together? How do we work together to get recognition, the gravity of this at national level? At national level, any thoughts?
Well, we know the links between poverty and child health and well-being and education and social care. So we know them and we've got plenty of evidence. So how do we continually bring that out and connect it to what we're talking about in each of these singular spaces? I think the comment has been made that in some places it's intentionally or perhaps accidentally not included in these discussions, but it's so clearly inherent to it. And we've known that in Newcastle for, well, how long? So it must be part of what we're talking about. I don't think there's any other answer really from my point. Nina?
And I think the challenge in my mind is that, it's recognized at international level. It's a couple of years ago now, isn't it, when it was all over the news about the food banks. And so it's not like people don't know, but how do we push that knowledge to translate to change and to action? And maybe some of that goes back to the point about really coalescing together around some joint key priorities, going back to Ian's point as well. Yeah.
And I think, we have to, unfortunately, many of us are trained in professional groups, and we think in professional ways, whether it's health, education, social care, and so on. And we do have to think about ways to work across groups and professions and drop some of that. So there's difficult challenges which people are working on and have been working on and will continue to work on. But I think given that poverty and inequality cuts across, we have to work in that sort of cutting across way.
And not just within the disciplines, but also linking to policy and policy makers, and really, really start to work absolutely hand in hand with them to change the resource allocation.
Thank you. Lula has mentioned really interesting work. What about children whose parents are affected by the criminal justice system? That further exacerbates the issues that's notorious, where there's little continuity between health and justice. So it's the link between health and justice, really. So that's an interesting perspective. Any thoughts on that?
I agree, it's really, really important, and something that I've kept an eye on, but is well beyond my expertise. I'm conscious there's a lot of social care colleagues on the call, so this is something I take to them if anybody wants to chip in.
Okay, so 12:29, we need to draw this to a close. What we can promise is that we will capture all the chat. I don't know why, but every time I end up with a meeting with Nina, I end up being given work to do. So I think the challenge is to try and focus on a place-based portal, really, on the website, which we'll promise to take away and pick up, really. I need to thank you all, really. Not just that we had a couple of hundred people have stayed the course, and I think that's reflected in the questions, but also the diversity of input that we've got. So I need to give a massive thanks to Nina and also Somon, and it's been a really fabulous talk. The next lightning talk will be in February, and that's very much around cancer outcomes, where Steve Clifford will be joining us, really. So all this will be on the NHIP website, and we will circulate that sort of information. So finally, I need to thank to you, to the audience, for coming today. We've kept it very concise, brief. It's been a very stimulating topic, and we've got clearly further work to do on this, but it's a lovely start in terms of this programme of work that we're building. So have a good day, and thank you very much for joining us. Bye-bye.
Thank you very much from us too. Take care.